Hello friends, myself Dr. Sanjeet Kumar. Today we are going to continue the same topic, postmortem examination. External examination. First, clothes. Examine for the stain of blood, saliva, semen, vomitus or fecal matter, foreign hair, cuts, burn by fires or acids, holes or blackening from firearm. Clothing must be carefully examined in firearm injury rape survivor victim as an important evidence. Clothes remove carefully layer by layer without cutting or tearing them. Use separate bag for each piece of cloth. Preserve clothes for forensic analysis if required. Then condition of body or build of body: thin build, average build, fatty build, emaciated or cachexia body. Then marks of identification, mainly in unknown body. Note the height, weight, age, sex, hair distribution with color, grey or black with approximate percentage, scars, tattoo, record fingerprints. A state of natural opening: eyes, ear, mouth, nostril, anus, urethra, vagina. Vagina is examined for the injuries, foreign body, discharge like pus or blood. Conditions of eye: closed or open, cornea hazy or clear, conditions of pupils, conjunctival hemorrhage or any deformity. Then a state of limbs, dents of hand if clenched, bone or joint, cyanosis of fingernail beds, genitalia of breast, size, masses or any other pathology. For male genitalia, prepuce, circumcised or not. Rigor mortis, absent, partially present or fully present. Postmortem lividity, absent, partially present as patch form or fully present. Postmortem lividity not fixed or fixed, mentioned about the pressure point. Then in case of ligature around the neck, its exact position, manner and application of a knot. Back for bed sore or a spinal deformity. Decomposition changes, adipose hair formation, mummification, skeletonization and maggots. Then postmortem artifact. Postmortem injuries like fish and aquatic animal bite, evidence of growing by the testicle animal should be recorded. Detailed examination of external injury. So types of injury: size, shape, site in relation to the external anatomical landmark, types of weapon used, mode of causation, direction of application of force, color of injury, healing changes and duration of injury. Examine symmetrically so that none of the injuries should missed. Examination should done in order like first head, then right upper limb, then right lower limb, then left lower limb, then left upper limb, then front of chest and abdomen and then back of chest and abdomen. In suspected sexual assault case, swabs from the vagina, anal or oral area or any other suspected area. Use UV light to detect invisible seminal stain. Pubic hairs, comb and collect any loose hair and pubic hair cut, then submit for forensic analysis. Take nail scraping and nail cut and put in an envelope. Scraping is done either with a matchstick or with a filter paper twice folded. Use separate envelope for each nail and nail scraper. Total 10 envelope to be used. Seal each envelope and label it indicating which finger it belongs. Then additionally mark. Then internal examination. First head and neck, scalp, a skull bone, a scalp for contusion, swelling, laceration, incised wound, etc. Skull is examined for any fracture, any abnormalities. Membrane is intact or torn. Presence of extradural hemorrhage, subdural hemorrhage or subacnoid hemorrhage. Then brain, then base of skull, then vertebra, then a spinal cord for any injury or strychnine poisoning. Neck structure examination is important in case of asphyxia to differentiate between the hanging and strangulation. Thyroid and hyoid bone for the presence of any hemorrhage or fracture of hyoid. Trachea is examined for any foreign body, soot particle in case of burn and gastric content in case of gastric regurgitation. Then additionally mark. Then thorax, wall, ribs, cartilage for any fracture, pleura, diaphragm, pleural cavity for the presence of adhesions and the foreign bodies and for the collection of blood and pus, larynx, trachea and bronchi, right lung with weight, examine for the soot particle or foreign body or any pathology, left lung with weight, examine for the soot particle, foreign body or any pathology, pericardium, pericardial fluid is examined for any blood, cardiac tamponade, pus or pericardial effusion. Then heart with weight, cavities, valves and coronaries. Examine for the valvular disease, condition of endocardium, any evidence of myocardial infarction, right ventricular hypertrophy, left ventricular hypertrophy. Coronary artery examine for the obstruction or thrombosis in their lumen. Large vessels, size of aorta, aorta for any aneurysm or plaque formation. Additionally marked. Then abdomen, walls, peritoneum for adhesion, congestion, inflammation or accumulation of fluid or pus. Peritoneal cavity, buccal cavity for froth or any drugs. Teeth, tongue for hemorrhage, bite mark and color changes. Then pharynx. Then oesophagus for the presence of varices. Stomach and its content measured and examined for their smell, color, character, presence of any foreign particles. The contents are preserved for the toxicological analysis. Then small intestine and its content for the presence of congestion, inflammation, erosion, ulcer and perforation. Large intestine its content, presence of congestion, inflammation, erosion, ulcer and perforation. Liver and gallbladder, liver examined for size, weight, surface, smooth or rough, shrunken, nodular cirrhosis, fatty changes in the chronic alcoholism. Look for any injuries or its nature and dimension. Gallbladder for gallstone, growth, character and quantity of the bile. Then pancreas for the fat necrosis, especially around the tail and the presence of any injury. Spleen, note the size, weight, color, consistency, the presence of any injury, most common organ to get injured. Then kidney, note the size, weight, color, examine capsule, whether the adherent or stripped off easily, degenerative changes and the presence of renal calculi. Urinary bladder, examine for congestion, hemorrhage, inflammation and ulceration of its mucous membrane. Urine should be removed and preserved for the chemical analysis. Then organ of generation, examine for any disease or malignancy. Testes and prostate examine for the enlargement, inflammation or any growth. Uterus is for any growth, presence of fetus, note its age. Vaginal canal for the presence of any injuries of foreign body, note the condition of hymen and additionally mark. Viscera and other sample collected from the body. Then opinion, it includes whether injuries are antemortem or postmortem in nature, then duration of injuries, then cause of death, then time since death, then weapon used. In case of more than one weapon is used, all the injuries caused by the every weapon must be accounted for. Viscera preservation and sent to state FSL for the chemical analysis. Pathological organ preserved and sent to the Department of Pathology for the histopathological examination. A portion of sternum or portion of femur preserved and sent to state FSL for DNA profiling in unknown body. In suspected sexual assault case, vaginal swab, anal swab or oral swab preserved and sent to state FSL for DNA profiling. In suspected sexual assault case, vaginal swab, anal swab or oral swab preserved and sent to Department of Pathology for detection of spermatozoa. Any additional remark? This is all about detailed examination of body during postmortem. Okay, thank you for watching.